Hi everyone, I am Dr. Mohan. I am consultant neurophysician from Yashoda Hospitals, Somajiguda. Today I am going to discuss about stroke. Stroke is a cerebrovascular accident defined as sudden onset neurological deficit in a patient of vascular origin. It is of two types. One is ischemic stroke, which is caused by a clot in the blood vessel, artery supplying to the brain. And another is hemorrhagic stroke, caused due to rupture of the blood vessel, causing bleeding into the brain tissue. And coming to the etiology of the stroke, that means what causes stroke. And there are certain risk factors which increase the risk of stroke in a patient. And they are age of the patient, if you are more than 65 years, and if you have a strong family history of either stroke or cardiac disease, or if you have hypertension. And hypertension is the most significant risk factor for both ischemic stroke and hemorrhagic stroke. And it is a modifiable risk factor, which means that we can actually reduce the risk of the stroke by treating hypertension. And there is an acronym rule of 10 coming to the describing for hypertension, which means 10% of the people who have hypertension are actually diagnosed as hypertensives. And among the patients, only 10% of who are diagnosed with hypertension actually get adequate treatment. So we need to be careful, and especially when you have family history or if you have any other risk factor, and you need to check your hypertension regularly and keep it under control. And coming to the other modifiable risk factors, they are diabetes and smoking and alcoholism, and excessive alcohol intake especially can increase the risk of stroke, and obesity. And with the rise in urban population, and there is increased risk of obesity, especially abdominal obesity in India. We are genetically more prone for that, and which increases the risk of stroke. So how do you identify the stroke? So the symptoms of stroke are any sudden onset. It is very sudden onset, and the patient was absolutely fine few minutes back. Now they are unable to speak, are unable to understand what you are saying, are unable to move the limb, hand or leg, or they are not able to feel one side of the body, or there are any tingling sensation or numbness on one side of the body. So any sudden neurological symptom should be taken as a stroke unless proved otherwise. So WHO has actually given an acronym for identification of stroke. It is FAST, which means facial deviation and arm weakness and speech difficulties, and T is time to react. The most significant factor in deciding the treatment of stroke is time to react. So that is the most limiting factor in the treatment of CVA or stroke. And very few people are aware that they should come to the hospital as soon as possible, and preferably less than in 1 hour. Because once you have stroke, time is brain, which means every minute you are going to lose 1 million neurons in the brain, and it is an irreversible damage. So the first thing to do once you see the symptoms of any of the symptoms of stroke, you need to first identify, call an ambulance and go to the nearest hospital as soon as possible. And then they will get a scan done, either CT or preferably MRI, and either ischemic stroke or hemorrhagic stroke depending on the scan findings. And one common misconception is to start treatment without getting the scan done, and that is not at all advisable. It is clinically impossible to differentiate between ischemic stroke and intracranial hemorrhage, and the implications are devastating for the patient, and it is always preferable to get the scan done. So once the patient comes to the hospital, and we will do a scan, preferably MRI, and diagnose the patient to have either ischemic stroke or hemorrhagic stroke. And if the patient has ischemic stroke, and if he is in less than 3 hours of duration, and acute therapies for the reversal of stroke is possible. They are thrombolytic therapy as well as thrombectomy. The thrombolysis therapy has 2 injections available right now. One is alteplase, another is tenecteplase for the CVA. And mechanical thrombectomy is an invasive procedure done by interventionist. The window period for the thrombolysis is 4.5 hours, whereas the window period for thrombectomy is up to 6 hours. And it depends on the patient to patient basis, and it can be extended up to 48 hours on case to case basis. And once the acute phase of the stroke is passed, that is after 24 to 48 hours, and the patient is started on other therapies, rehabilitative therapies as well as preventive therapies for the further incidence of stroke. Many people are not aware that once you have a stroke, and you are always at risk of getting another stroke for whole life, and especially in the initial 3 days of the stroke, and where you need to take medications, antiplatelets as well as statins for the prevention of recurrence of stroke. Coming to the ones after the scan, if the scan shows a hemorrhage, and the treatment is entirely different, and it is predominantly directed towards the BP management of the patient. And depending on the GCS, Glasgow Coma Scale, and as well as the brainstem reflexes, we will further decide about how to approach to the individual patient case to case basis. And how do we prevent this stroke? So the prevention of stroke relies on and the prevention of first stroke and prevention of recurrent stroke. And prevention of recurrent stroke is especially important because you have already a stroke and you are further at risk. The risk actually increases up to 20 times. So to have another stroke. So the prevention of recurrent stroke depends on antiplatelets and taking them regularly, and statins for lifelong. So what are the other causes of stroke? And the patients who have cardiac disease, they have higher risk of getting stroke. And patients who have uncontrolled hypertension, they have higher risk of getting stroke. And there is a special group called stroke in young. And if you are less than 40 years and if you don't have any other risk factors, still some people can get stroke, which is very rare, and it is stroke in young. And the common causes are cardiac origin, where they have rheumatic heart disease and which is causing stroke, and the other non-cardiac sickle cell disease or CNS vasculitis, connective tissue diseases, and post-viral vasculitis, and these all can present with strokes. So we need to be aware of stroke mimics also, and most common stroke mimics are hypoglycemia, hyperglycemia episodes, especially in diabetics, and with the either increase or decrease in the blood sugar levels, which can present as stroke. And another most important one is seizure, that is fits, which can present with loss of consciousness followed by weakness of either one or both limbs. And it is clinically not possible to differentiate between either stroke or stroke mimic. That's why it is always preferable to go to the hospital and get the scan done. And once you are diagnosed with the stroke and you are discharged from the hospital and the treatment is not fully done, you need to take your medications regularly, preferably throughout your life, and you need to undergo physiotherapy, rehabilitation, other rehabilitation like limb physiotherapy, and as well as speech therapy and sensory stimulations, and for patients who have sensory deficits. All these are important and they tend to act over time. Thank you.